Hi, my name is Cortes-Garcia. Today we're going to talk about the prostate and eventually into the different disorders that it may have into erectile dysfunction. So let's talk about the prostate and see where it's located. Here's a picture that details the anatomy of a male. So we could take a closer look of where specifically the prostate is located. So as we can tell by this picture, the prostate is located right underneath the bladder. It actually hugs the urethra, which is the tube-like formation that you see there, and it carries urine from the bladder on through the prostate, out through the penis, and out of the body. Now, the prostate itself is a gland which is used to secrete prostate fluid, which is one of the components of a seminal fluid. So prostatitis, it basically refers to just the inflammation of the prostate. Typically the prostate is about the size of a walnut. Over time, it actually increases in size slightly. Now, when there's the inflammation of the prostate is when it's referred to prostatitis. This could be caused by bacteria, most commonly, or it could be caused by different other things, such as having high blood pressure, or diabetes, or any of those sort of things. So if you think of the anatomy of a male, the prostate hugs the urethra, which is a passageway of urine from the bladder on out of the body. Once it actually gets inflamed, it squeezes that urethra closed, causing the urine to back up into the body, and that typically is the reason why there is urinary tract infections, and that's where the pain comes from at times. So some facts. Prostatitis is one of the most common diseases in men which are younger than 50 years old. Now, when we're talking about men older than 50 years old, it's actually the third highest or most common urological diagnosis given to them. Moving on to erectile dysfunction, it actually affects over 100 million men worldwide. Here in the US, about 52% of men between the ages of 40 to 70 years old have some degree of erectile dysfunction. This could be anywhere from having difficulties getting an erection to maintaining an erection, and anywhere in between. So there are different types of factors that contribute to erectile dysfunction. Erectile dysfunction could be caused by depression, but also by high blood pressure, by diabetes, smoking, high cholesterol, sometimes trauma to the pelvis or the spinal cord, multiple sclerosis, just the overall different types of disorders. There are two columns that surround the penis. These columns are referred to as corpus cavernosum. They fill up with blood during an erection. So if you think about hypertension or diabetes, and you think about the arteries and how those could potentially get clogged or damaged in these processes, the same thing could happen to the vasculature in the penis. It actually becomes blocked, causing the erectile dysfunction. There are different medications out there in the market that currently can help you with erectile dysfunction. It could be something as simple as an oral medication, such as your Viagra's that you hear about in commercials. You could also have injectable drugs, to penile implants, to sex and counseling therapy, and other more invasive procedures. The same thing happens with prostatitis. There's different medications out there that could actually help you to treat prostatitis. Again, sometimes one causes the other, but not all the time. So it's important for you to consult your doctor to see the best treatment that applies to you. Whether we're talking about erectile dysfunction or prostatitis, definitely cut back on your smoking or stop smoking, and your drinking also, as both of these could interfere with the medications, both the antibiotic and also the erectile dysfunction medications. When it comes to prostatitis, most times doctors will prescribe some type of antibiotic. And again, there are some precautions around antibiotics also. Definitely take all your antibiotics as prescribed. if your urination becomes different from what you're normally accustomed to, or if you're having episodes of bedwetting, or where you have that sense of urgency that we spoke about earlier, let your doctor know. There are certain risk factors that come along with the inflammation of the prostate. So we want to rule out things like cancer. Definitely go get screened for cancer on your prostate. I know the procedure is not something that most people like to talk about, but it's definitely something that we all need to do. The doctor could also do a test in your blood, which is called the PSA3. It stands for the prostate specific antigen 3, which looks for cancer in your blood. Do not take any medication without first consulting your doctor, especially when it comes to erectile dysfunction medication. I know there's a lot of products out there that claim to help you with this process. However, some of this medication could cause your blood pressure to drop lower than it should, especially if you're taking a medication for your blood pressure. Also, let your doctor know if you have an erection that lasts for more than 4 hours. Even 4 hours is a little excessive, but definitely when it gets to be more than 4 hours, it starts to become painful, and it is definitely a medical emergency. Some of these topics that we've discussed today may be somewhat uncomfortable for some of you, and that's okay. But definitely trust in your doctor. They will keep your confidentiality